the word nursing can be used in a lot of different career fields.
Right.
For actual nursing positions, you have your LPNs, your RNs, you nurse practitioners. What's the differences in education? What's the difference in duties and responsibilities between those? Some generic ones.
Registered nurse can give IV medicines, IV fluids, does clinical assessments, advanced assessments, those types of things. So that's, and there's more education. So an LPN has a very limited education, and then there's a couple more years for the RN. And then the advanced practice nurse, where your nurse practitioner, your CRNA, your midwife, and your clinical nurse specialist, those 4 roles all have a minimum of a master's degree or a doctorate degree. And we prescribe, we diagnose, we order tests. We have a much broader scope of practice. We can do procedures. We can order diagnostics. We can admit to hospitals if we have privileges, those types of things. So there's a lot more things that we do, but the education is a lot more extensive. So we have our RN degree and experience, and then we build on that education and do a lot more education. Within nursing, there's so many things you can do. You can be at the bedside, you can teach, you can do quality things. There's informatics, there's nursing informatics now to develop software and computer programs for charting and all kinds of other things.
Are there any like non-physical type positions, kind of what we're talking about there, but with no prior experience? Or does that new graduate typically have to go into a hospital setting, more intensive type setting, before they can maybe work their way into a doctor's office type?
Not necessarily. It just depends. It depends on what they've been doing while they've been in school. I know new grads that did not work in a hospital setting. That just wasn't what they wanted to do after being in clinical, and have just done community nursing. There's lots of community positions. And not just in doctor's offices, but there's school nursing. School nursing is a very critical piece of community nursing. There's lots of opportunities within the community, which are a lot less strenuous than working in a hospital for 12 hours.
And nurses have to be licensed through South Carolina LLR, also known as Labor Licensing and Regulation.
Correct.
Can you tell us about that certification process, and like the renewal? How often does that happen? Is there cost involved?
Nurses are licensed, not necessarily certified. If they are certified, it's an extra certification, but it's just a license for LPNs and RNs. It's every 2 years. It happens every 2 years at the same time, usually in April. We do have a couple ways that you have to get renewed, or your license renewed, and one of them is through continuing education. And that's a point that's worth making, is no matter what the field is, you can always get more education. We don't stop learning once we're in our field. I don't know of a field around, especially in healthcare, that you know it all and say, okay, I'm done. There's nothing else to learn. COVID would be a good example that none of us know anything about, and we've had to learn this entire pandemic.